The Research Institute at Connecticut Children's is absolutely something that, to me, is the most important thing that I have done or could do and will do with the people here. And why is that? Because children's hospitals need research. Children's hospitals need an organization that can actually bring innovation to the care of kids, and we're doing it here at Connecticut Children's.
The research that we're doing at Connecticut Children's really benefits our families and our patients, mainly because we're always thinking about how we can do better, how we can optimize our treatments, how we can optimize the science behind the way we make the diagnosis, and really try to be leaders in this field because our patients and families are at the heart of our mission.
We've been doing research since before we opened our doors in 1996, and so the research that we've been doing really has evolved, and over the last 10 years, our publications have grown sevenfold.
It has never been more important for research to inform what we're doing in the clinics, in the operating room than today. We have so many more tools available to us in the research environment, and it is a long road translating those discoveries, those advances, into clinical management.
Next year I will be at Connecticut Children's for 20 years. When I started, we had a few people going to PAS, we had a little bit of grant funding, and now we have world-class, highly funded researchers. We're doing clinical work, we do QI work, we're doing some really high-level genetic research and bench research. We're sort of a go-to place.
One of the most exciting aspects of what we're doing in the Research Institute is partnering with the Connecticut Children's Center for Innovation.
My research areas focus on regenerative medicine and stem cell therapies, mainly trying to take some of the treatments that we currently have and make them better, and have children really benefit from their own bodies and healing their own bodies. We do really respect, in fact, I have two outside external collaborators, without which my research wouldn't get as far as it's gotten. So collaboration is key importance.
And here at Connecticut Children's, in conjunction with a number of other people, we're developing a professional point of care test that could be used by emergency room doctors to easily diagnose MIS-C, COVID-19, and perhaps other diseases. So we're very excited, and that's something that came out of Connecticut Children's. The other project, which is very important, is the developing of a syphilis vaccine. Now, syphilis can affect children. People don't realize that, but it can affect moms that are pregnant with really serious effects to the unborn baby. Worldwide, about 500,000 kids die as a result of congenital syphilis. So our laboratory here at Connecticut Children's and the University of Connecticut is developing a first of its kind syphilis vaccine. Very important project, and we hope over the next 3 to 5 years to actually have something that can be used in clinical trials.
Perhaps one of the more far-reaching areas of research that I'm directly involved in is the development of placental gene therapy. This is targeted towards a number of diseases. One is fetal growth restriction, another is preeclampsia, and in preterm labor.
We're all here to help kids, and that means that anytime I reach out to another researcher with an idea for a joint research project, they are super passionate to try to use that idea to advance kids' health.
Connecticut Children's Research Institute is very fortunate to have very strong partnerships with our colleagues out at Jackson Laboratory and also with the UConn School of Medicine and the UConn campus out at Storrs.
One of the things that we've been striving for here at Connecticut Children's is understanding that we have to treat the whole child. So oftentimes you'll hear about our research in the Cancer Center or in GI, but really regardless of wherever research is being done, that child's mental health is critical because that's going to influence outcomes, that's going to influence course, that's going to influence every single part of that child. And so we really like to integrate mental health research into every single research project that occurs here at the hospital.
That environment of being surrounded by people who are passionate about research, who have experience in research, that's one of the best things I like about Connecticut Children's.
You know, over the next 5 to 10 years, there are going to be so many new therapies, new ways of diagnosing, treating, preventing disease for children. With our Research Institute here at Connecticut Children's, the building of our new tower, our extension, the future is incredibly bright, and research is going to take us in that direction.